name is Jenny. I'm the student nurse practitioner. I'm going to be doing an assessment on you today on your head, eyes, ears, neck, and throat. Okay? First thing I'm going to do is just, can you tell me your name and date of birth?
Tracy Douglas, 10/17/1971.
Can you take your hat off? I'm just going to look at your hair, look at your, everything looks symmetrical. Your ears, your eyes, your nose. You have nice, clean facial hair. You have no body odors. I'm just going to touch your skin now to see if I can, for a temperature. Everything feels nice and warm. Can you lift up your shirt for me? Just going to touch your back. And if you can raise your sleeves. Good. Good. And your pant legs, please. Great. The hair is nice and symmetrical. He doesn't have any bald spots in his hair on his legs. His skin turgor looks really good. He doesn't have a very high moisture. And I'm just going to check your skin turgor right here. It's nice skin turgor right there. His skin is moist, not where it's sweating or anything like that. There's no lesions that is noticeable, and his hygiene appears to be good. Next, I'm going to put on some gloves, and I'm going to just look at your scalp, okay? I'm going to check your hair, and it looks like you have some nice, good hair. It's nice and coarse. It's nice and clean. And I don't see any lesions or anything like that, and there's no nits. Okay. So then what I'm going to do next is I'm going to have you hold out your hands. Put your palms up. Nice, good, smooth hands. He does have a couple of calluses. What kind of lip work do you do?
Work on a milk or dairy.
Okay, good capillary refills. And his nail beds are nice and clean. His nails are not bitten, they're not chewed, and they are equal. There's no clubbing noted. Okay, cuticles are nice and clean and good capillary refills. Great. Do you have any tattoos?
No.
I don't see any bruising or anything like that when I lift up his shirt. Doesn't look like there's any kind of like signs of abuse. He does have a little bit of like acne on his back, but other than that, he's good. So I'm just gonna touch your head. His eyebrows and eyelashes are equal. Do you have any pain whenever I touch right here in your frontal sinuses?
No.
Your maxillary sinuses, any pain here?
Nope.
His lips are nice and symmetrical. His nostrils are nice and symmetrical. He has no lumps or bumps in his neck as well. Looks like his ears. There's no disformities in his ears. And then I'm going to go ahead and just, since I'm touching your neck, I'm going to go ahead and just feel for your lymph nodes here. This is your preauricle, your postauricle, your tonsillar, your submandibular, submental, anterior cervical, posterior cervical. If you could just turn your head to the left, your deep cervical, turn it to the right, your other deep cervical, your intraclavicular, and your occipital. I do not feel any lumps or bumps in his lymph nodes at all. Next thing I'm going to do is I'm going to check your neck out. His trachea is nice and midline. I have a cup of water here. I'm going to have you take a drink of water. I'm going to watch you swallow. His hyoid bones moves up and down nice and freely. I'm just going to feel for your thyroid. I can feel there's no goiter or anything like that. Everything feels great. Now I'm going to have you take another swallow. Great. I didn't feel any masses or anything like that. Okay, so what I'm going to do now is I'm going to listen, put my stethoscope on your temporal artery. And I can feel. I'm going to listen for any brewing. I'm going to listen to your eye. The same thing with your. Great. I'm going to feel right here. I'm going to have you open and close your mouth. I don't feel any crepiness at his temporal mandibular joint. Everything looks great right there. Next, I'm going to go ahead and I'm going to whisper in your ear, and I want you to repeat what I've whispered to you.
Baseball. Cars.
Great, great. Did you have any problems with that?
No.
All right. Next thing I'm going to do is I'm going to do a test. It's called the Weber's test. And when I hit this, my fork, I'm going to put this on your head, and you're going to tell me when it stops, the vibration. Is it equal in both ears?
Yeah.
Did it stop?
No, it didn't.
Okay. I'm going to do the same thing. If this is called a Rennie's test. Can you hear that?
Yeah.
Let me know when it stops.
No.
Can you hear it now?
Yeah.
Okay. Can you hear it?
Yeah.
Let me know when it stops.
No.
And can you hear it again?
No.
Now I'm going to go ahead and look in your ears. This tympanic membrane is nice and white, pearly white. There's no cecum there. There's no, it's not red, it's not draining or anything like that. Same with the other side. There's no drainage, there's no cecum, and anything like that. Next, I'm going to look in your nose. There's no drainage, there's no redness, there's no deviated septum. All right, now I'm going to look into your eyes. First, I'm going to have you watch my scope. And he has good vision and all around. Next, I'm going to have come behind you, and you're going to tell me when you can see my hands. Okay?
No.
Great, great. I'm going to look into your eyes now. Just make sure that you have, I'm going to cover one side and cover the other side. Pupils are equal and reactive to light. And now I'm just going to look. I can see the optic nerve. I can see the reaction to the light, the blood vessels in the back of the eye. Everything looks good. Same with this side. Great. Now I'm going to turn on the light here. I'm going to have you cover. I'm going to have you look at this Snellen chart and just kind of read this line for me with both eyes.
DHJBS.
Can you cover your left eye and read that line for me?
OLGF.
And cover your other eye and read this line for me.
DHJBS.
Great, great. So everything looks good right there. Your lens clarity looks great. You have a great reflex. Your retinal is good. Your disc is good, and I don't see any macular changes. Okay. While I was looking at your eyes, I'm just gonna look at the conjunctivis. His sclera is nice and white. There's no bloodshot, and his conjunctivis is very good as well. I'm gonna have you open up your mouth. Right now. Open up and say ah. He has nice, good tonsils. They're not red. There's no drainage. His uvula's moving up and down real good. Can you stick your tongue out? Great. He's got a good, nice gag reflex. I'm gonna stick my finger in your mouth, just feeling for your teeth, any loose teeth. There's no swelling or anything in his gums. Everything looks really good. And everything looks great on you. Do you have any questions for me?
Nope.
Alrighty. Everything looks really good. It looks like you appear to be very healthy. What was those questions that I asked you earlier? What was the words that I asked you?
Cars and baseball.
Great. All right. All right. Thank you.